Joining us live via Skype is Dr. Ibrahima Soce Fall, World Health Organization's representative and head of the United Nations Mission for Ebola Emergency Response. Dr. Fall is based in the WHO's Regional Office for Africa in Brazzaville and joins us today from the organization's headquarters in Geneva. Dr. Fall, welcome to the show.
Thank you. Thank you.
So last week, West Africa was declared free of Ebola, and then a day later, someone was reported to have died of the virus. What went wrong, Dr. Fall?
Thank you very much. I think WHO declaration was very clear. On the 14th of January, WHO declared the end of the outbreak, meaning that all the known transmission chain has been stopped for more than 42 days. So in this declaration, WHO warned countries to tell them there is still residual risk since we have a number of survivors who can still carry the virus. So this is not something we didn't expect, and countries also were informed about that and were getting ready to be able to rapidly detect any residual transmission of Ebola. So this is not something we didn't anticipate.
So as we anticipated this to happen, perhaps, what was being done to prevent this to happen, though?
If you look at, even after the end of the outbreak in the three countries, the work was still going on. We have more than 1,000 WHO experts in the field working with partners in the country to reinforce the surveillance and to build rapid response teams to make sure that countries will be able to rapidly detect and respond to any new outbreaks.
So what is the situation currently? Where do we stand? More than 100 people have been put in quarantine. What is happening?
As you know, when you have a case of Ebola, it's important to identify all the potential contact, meaning the people who may have been in contact with the case. So that's what the authority in Sierra Leone have been done, and they have identified around 100 people who are under surveillance, meaning they will be monitored to make sure that if there is any secondary case, it will be picked up very quickly and taken care of.
So does this raise concern that the outbreak may perhaps start again? How much should we be concerned?
I think the situation is different from last year or 2 years before because, you know, the three countries, Sierra Leone, Liberia, and Guinea, have now the capacity to detect and respond very quickly to any new outbreak. So we are not expecting an expansion of this outbreak because the country and the partners are working together to make sure that this will be contained very quickly.
Now, Dr. Fall, a lot of people, observers, have criticized the WHO for not responding quickly and really raising the awareness as to the danger of this outbreak when it was happening in the beginning. What has changed this time around? What are the lessons learned?
I think many things have changed because if you look at the beginning of the outbreak, the countries didn't have the capacity to detect and respond very quickly. And partners themselves were not ready to respond in a well-coordinated manner in an outbreak of this magnitude. And since that time, we have learned a lot. More capacity is available at country level, and partners have learned to work together to rapidly support the countries based on their comparative advantage. I think the situation is completely different right now. And WHO is going through a reform process, taking into account the lessons learned from this outbreak to make sure that, you know, the response to any type of outbreak or emergency will be more quicker, more stronger, and well coordinated.
And quickly, before we go, what are the priorities then moving forward?
The priorities are at different levels. At country level, everything related to health security, meaning integrated disease surveillance and capacity to respond very quickly is important because the first line responder are at country level. Within partners and WHO, we need really a system where we'll be able to trigger international mechanism for coordinated and comprehensive response to all types of emergencies, including outbreaks.
Okay, Dr. Fall, thank you so much for joining us.